Good afternoon, everyone. I'm Beth Stroll, and I would like to welcome you to the System of Care Leadership Learning Community. For the Technical Assistance Network for Children's Behavioral Health, Denise Sulzbach and I co-facilitate this learning community. We hold the learning community monthly, and we have designed this to support System of Care leaders in all roles. Maybe grantee leaders, coordinators, directors. It could be leaders in various content areas, and also leaders in states and communities, tribes and territories that don't have federal funding for their System of Care expansion work. And we welcome all other leaders that have roles in System of Care implementation or expansion. And we try very hard to address topic areas that are of importance to you as leaders in your states and communities. And we welcome your suggestions for topics that you might like us to cover during these learning community sessions. One of the things that's important to us is to make these as informal and interactive as possible. So I'd like to encourage you to use the chat box throughout for comments, for questions, for conversations, and we will do our best to make sure that your questions are responded to. We will have a period of time for question and answer at the end, but if possible, we may be able to respond to some of your questions during the presentation. And again, to keep conversations and interaction going throughout the webinar, we certainly appreciate that. Before we get started, I wanted to mention the next Expansion Learning Community meeting, and that will take place in November on the 15th. At our usual time, which is 2:30 to 4 o'clock p.m. Today was a little bit different, but our normal time is 2:30 to 4 o'clock Eastern Time. The topic will be considerations for System of Care leaders for serving youth and young adults of transition age. We have two communities and states and some experts in transition services for youth and young adults of a transition age lined up for that, and I think it should be a very exciting webinar with information that it's important for you as leaders to consider as you may want to expand your systems of care to strengthen or add services for this population. So today the topic is state-community partnerships for System of Care expansion, and we have a number of presenters, and we are very fortunate to have presenters from both New Hampshire and Virginia who will talk about how they have approached partnerships to accomplish their goals for System of Care expansion. I'll be providing a framework for this, and then New Hampshire will talk about their approaches, and then Virginia will follow and talk about how they have approached working as a partnership between the states and the various communities in the state to accomplish shared goals around System of Care implementation and expansion and sustainability, of course. So the objectives for today's meeting are, one, to discuss the importance of state-community partnerships, two, to present a framework of partnership strategies, third, to review recommendations from the various state-community dyads that we looked at for creating effective partnerships, and then to look at the strategies, as I mentioned, for state-community partnerships in two states. I want to make sure that we all understand that when we use the word state partnerships, we also mean this to apply to tribes and territories where system-level changes are needed also in conjunction with local communities that are within their jurisdiction. So we're using that term inclusively and not intending to leave out tribes and territories. It's all something that we want to refer to together. So here's a framework for state-community partnerships that we developed. First of all, you probably all know that the System of Care approach was introduced in the 1980s to improve services and service systems and outcomes, of course, for children with behavioral health challenges and their families. And from 1992 to 2011, SAMHSA gave out grants for System of Care development, most of which to local communities and states, some of them to states, but mostly to develop systems of care in local communities. And a very robust evaluation found positive outcomes, good return on investment, and SAMHSA shifted its approach from developing systems of care in communities to widespread expansion, feeling that the time was right to take systems of care to scale. We had the evidence and it was time to move toward a widespread adoption of this approach. Since 2011, grants have provided funds to states, to communities, again, tribes and territories, to support expansion, but also a lot of states and communities are using their own resources for system of care implementation and expansion. And the information that we'll be talking about today, and in all the webinars we do through the System of Care Expansion Leadership Learning Community, are applicable to not only grantees, but to other states and communities that are working in this area on their own without federal funds. You probably have seen this diagram before. It's a SAMHSA's theory of change, which basically shows that you can take an innovation and you can disseminate it, evaluate it, implement it, and then at that stage it's ready for wide-scale adoption. And the thinking was that the system of care approach was in this category where it was demonstrated and developed in many communities, I think over 300 throughout the country, and evaluated, and then the evidence supported moving this to widespread adoption. And at the time that was happening, we really looked at a framework, creating a framework that is kind of a roadmap for system change. And through a study of a number of states that had already began an expansion, we came up with 4 core strategy areas: policy and partnerships, services and supports, financing, workforce development, and strategic communications. There are sub-strategies in each of this area. They're all overlapping and interrelated, but those seem to be a broad characterization and framework for the areas that need to be addressed to expand the system of care approach, but not only the system of care approach, any service innovation in health and human services. These are all the areas that need to be addressed in order to accomplish those goals. And from initial grantees and looking at those, we learned some significant lessons. One, it confirmed really that expanding systems of care doesn't occur at one level. It's a multi-level process, and that we need changes both at state and local levels. And change at one level is not sufficient, so that we need what we've called a bidirectional approach that really involves making changes at both the state and the local level, and that these partnerships are essential to make sure that that happens, and that strategies are aligned, that they are implemented in tandem, that there's not a disconnect between work that might be happening at the state and the local level. In a nutshell, states have to change policies and financing and workforce efforts and various structures and processes. Communities are the ones implementing the system of care infrastructure, the services. The state-level systemic changes have to be accompanied by local-level changes to implement systems of care, and local implementation must be accompanied by high-level systemic changes for sustaining the approach. And it's the synergy, really, between the state and the community, the top-down, bottom-up, that are needed for system change. Here's a slide that just shows you the various roles of states and communities in expansion and sustainability. And I won't go through all of them, but you can see that states establish a vision, a consistent set of policies statewide. There could be legislation, interagency partnerships at the state level. And one of the most important ones is financing for the infrastructure for services and supports, that while communities may be implementing without financing, say, for Medicaid or child-serving systems, the chances for sustaining these services are greatly reduced. And then at the local level, communities pilot approaches, they implement and provide services, they work on partnerships, they provide data that make the case for further expansion and bringing systems of care to scale. They can train other communities, help develop family leaders, and generate support, which among leaders in child-serving agencies, which is a significant factor in having success in your expansion goals. This is a pyramid of system change that was developed through a meeting that was held by SAMHSA, an expert panel on the theory of change. And that meeting included delegations that included a local and a state representative from, I believe, about 10 states. And it shows, and it depicts what it was I was just talking about, that there's a shared mission, that all those system change strategies occur, that local levels implement infrastructure services. We look at the results in terms of outcomes and return on investment, and ultimately that leads to expansion of the system of care with the values, of course, on the sides that permeate all of these activities. So we took on a project to evaluate and explore what state-local partnerships look like. And we wanted to do this to provide guidance for other states and communities on what they could do to maximize the achievement of goals that they share, to improve services and outcomes for children with behavioral health challenges. And we looked at this in 15 grantees, 11 states, and 4 community grantees that said that they had partnerships in place. And we also looked at one state that didn't have a grant but was using a very strong partnership approach, and that was New Jersey. So you can see the systems of course, New Jersey now has a grant, I should clarify, but you can see that these are the states that we looked at, these are the communities that we looked at. And as a result of doing this project, we were able to develop a categorization, a typology, I guess, with 3 main approaches to partnerships between states and communities. 1 was selecting communities, 2 funding communities, and 3 aligning communities. And I'm going to talk briefly about each of these ones. In terms of selecting communities, states that we looked at selected specific communities for participation. And as of 2015, and most of you probably know this, it became a requirement of the SAMHSA System of Care grants that states have to select at least 2 designated implementation sites and demonstrate how they're going to expand to other communities. And communities have to identify how it is they are going to work with their state agencies to make sure that the high-level changes that need to occur at the state level occur in addition to what they may be working on at the local level. In terms of selecting communities, there may be a competitive process. Some states have used RFPs to invite communities. There may be a way to identify communities through this process that are ready and committed and also generate interest across the state when they see that there's a selective process to get involved in the future. And then the second one, or the examples I have of selecting communities are Colorado, which issued an RFP for communities to work with them on planning and implementation, creating infrastructure and a service array, including wraparound, and how they'd involve families and youth and family advocates. And they selected 8 communities. They called them communities of excellence. They did provide some grant funds, and there was also a requirement that there be local resources put into this effort. Texas also issued a request for interest, and they selected 3 communities, and they tried to select communities at different stages of readiness to see how the development of infrastructure and services for a specific population that was identified by the local communities would work. Second approach that we identified was funding communities, and most of the states we looked at did provide funds to communities to support expansion planning and or implementation. They used, in some cases, their grant funds, their SAMHSA grant funds, but in other cases they used state funds for this purpose. And sometimes it was a local planning process that they supported. Sometimes it was startup costs for specific services or infrastructure. The funding was typically small. As you know, the expansion grants are not huge amounts of money, and state funds that may have been allocated to this were also small. And it really served in most of these places as an incentive or a seed money in these initial phases of system of care expansion. And one of the things that I like to emphasize is that we like to talk about this as venture capital, that grant funds are not the funds over a long-term basis that are going to be used to support system of care infrastructure and services and supports. It's venture capital. It's a way to get things started, and that actually nothing really should be implemented unless you have a plan ready for financing sources that are going to sustain this over the long term and transition to that. An example in Tennessee is this funding announcement. They selected 5 regions, and funding was provided for some of their work to both coordinate their activities with statewide and to support and inform state-level system change efforts, as well as to do some implementation locally. You can see the selection criteria here. There had to be a commitment to identify and invest local funds, partnerships, focus on a specific population, values of systems of care for family-driven, cultural competence, collaboration, and so forth. And one that I think is particularly important is the sustainability strategy, so that if they were receiving small amounts of, say, seed money or venture capital, how are they going to sustain this over the long run? So those were some of the strategies that were required as selection criteria. And the third area was aligning communities with states. In many areas, this involved community grantees reaching out to states to collaborate with them and to align their expansion work with what was occurring at the state. And many of these communities shared their successes, their lessons learned, to inform state-level changes, and particularly their challenges, because it gave states information that they might use to resolve barriers to community work on system of care implementation. And so that was important information. And also communities have provided tremendous resources to states for training and consultation and coaching for other communities in states that were at earlier stages of implementation and expansion to work on this. So in essence, I like the wording that Colorado used by creating communities of excellence, where they were developing expertise that then could help in the statewide effort to expand systems of care. Here's an example of that. In New York, communities applied for an expansion grant as a group. There were 12 communities initially that were involved in a learning collaborative. And the model served as a vehicle for communities that had more experience and were further along in the developmental process of systems of care to mentor and coach other communities that were at earlier stages of development. And last I heard, there were about 10 or 12 communities being phased in each year, and there was a goal of including all 55 upstate New York counties. Denise has been working with New York, and she may be able to provide a little bit of an update on that. But those communities work closely with the state agencies. They provided information. They talked about effective strategies that states could use, and of course their outcomes. And there were some small amounts of funds called innovation funds that were available to those communities to begin to build their infrastructure and their services. So we're going to pause for a minute for a polling question on which type of partnership strategy is most common in your state and community, and you can identify that, whether it's identifying and selecting communities, providing seed funding, and communities reaching out and engaging with states. Well, everybody at the community level has reached out and engaged with states, so that's great. On the state side, it looks like we have the smallest amount of responses around selecting communities to work with and seed money next. But by and large, we have, I think, the largest percentage of communities engaging with states, and that may reflect who's participating on the webinar. If we have a lot of community grantees participating today, the answer may reflect good work on your part to reach out and engage with your states. So let's continue, please. And how strong would you say the state-community partnerships are in your state? Not very, somewhat, moderately, very strong, exceptionally? Give that a moment. Well, moderately, very, and exceptionally looks pretty good. somewhat, and not very strong, not very strong, none of you. So also very hopeful. Moderately strong seems to be the winning category, and I think that demonstrates some progress and also some areas that we might work on to improve. If we could move on, that would be great. Okay. Okay, so here's some guidance for effective partnerships that were provided by all of the states and communities that we worked with. One was that a shared vision, shared goals, buy-in at both levels is critical. And recognition that the need for system change has to occur at both levels, that you can't improve services and outcomes without local infrastructure, but they can't be sustained without state support also. That it's important to create a win-win strategy that makes sure that both states and local communities benefit from the partnership. And there was a lot of specific advice that was provided by the states and communities that we looked at around communication and structures, et cetera, for partnerships, for funding, leadership, and so forth. And let's take a quick look at that. For communication, regular opportunities for continuous interchange, continuous feedback was considered essential. Some suggested that the use of a facilitator, a neutral facilitator, could be helpful to ensure frequent and productive communication. And in a couple of places, they used a state staff person who was dedicated to reaching out, communicating, and supporting communities. And that was reported as particularly successful as well. And then a clear communication about what the expansion goals are and what it will take from each level. And you can see some of the quotes, which were about it's all about communication and relationships, and to make sure that the relationships are not one-sided. Talked about structures for partnerships, and a lot of advice here that's important, involving communities early from a state perspective, formalizing the partnerships through agreements and contracts with clear communication about goals and outcomes, creating a process that states can use to learn from the experience of communities, a formal process, that there is concrete guidance about what the expectations are for communities to ensure that there is alignment and that we don't have mission disparity or mission confusion. Meeting communities where they are, including communities on state expansion teams, competitive processes for community involvement. Identifying strategies that can be replicated in other communities is important because widespread adoption is the goal, and we're looking for statewide adoption of the system of care approach, not in dots on the map, as SAMHSA used to call them. Now we want to go big. And so there need to be strategies that can be adapted or replicated in other communities, strategies for communities to share your expertise, to provide PA and training statewide, coaching for communities. And another important one was ensuring that state policies are realistic, that they're practical, that they're workable, and that communities aren't held to requirements that really are not realistic or doable. From the community side, the suggestions were that there is a way to ensure that local activities are linked to the larger systemic changes at the state level, that communities understand how policies, financing, budgets, legislative processes, reforms, and other initiatives at the state level are critical also to provide a context for the local work. And it's important for communities to reach out to the state with their ideas, their suggestions as to what works and how to partner and how the state might proceed in an effective way to achieve expansion goals. And then another area that I had very interesting conversations with some of the communities was how communities could demonstrate to state agencies how the system of care approach ties into other work at the state level, and that will further state goals. So it's not what is happening in isolation in communities, but what you're doing community level really can feed in to other work in the behavioral health system and other child-serving systems at the state level. The work of communities to actually reach out to state agencies and recruit them to participate on their teams, advisory boards, governance boards, was an important strategy. You will hear about that and how that was done in New Hampshire, and also to provide information about how local implementation has statewide significance and shouldn't be viewed as separate projects, which, by the way, is a pet peeve of mine, probably stronger than a pet peeve, is that system of care grants or system of care work or initiative is not a project. This is about system change. So when you think about your goals and what it is you're trying to achieve, if you look at it as a project, it's something that's likely going to go away when the project ends. And the way we can ensure the long-term viability of what it is that you're doing to create the broad array of services and supports and to create systems of care is to think about this as system change that has to be codified, not necessarily in regulation or law, but codified and locally and, of course, also at the state level in order for this to be sustained over the long term. So state-community partnerships should be formalized, and all local activities should be linked to system change at the state level and to activities to expand system of care implementation statewide. Funding, another of the strategies, providing funding to communities as incentives, using grant funds as seed money, using it as startup money and transitional funding. As I described before, this is not long-term financing, and we found that even small amounts of funding bind communities to this work and engage them more in an expansion effort rather than just technical assistance alone. So even if it's a small amount of money, it can have a very substantial impact. Leadership, another area, important to make sure that the right leaders from both states and communities are at the table from the beginning. High-level decision makers in state and local agencies who have the authority to make decisions need to be involved. And strong family and youth voice in expansion needs to be involved. That's critical for changing thinking among key constituencies and stakeholders at both state and local levels. And the quote here from one of the interviewees is that you need people at both levels who can be champions, who can work together, who can inspire other agencies and organizations to participate. So leadership and broadening that leadership base is critical. And strategic communications also, I think, is one of the strategies that brings this all together. And you know this is also called social marketing, and this is part of social marketing, that to generate support for state and community expansion, strategic communications can be used to provide data on outcomes, on cost savings, combined with family stories to make the case for system change. And another interviewee talked about the need for community-level buy-in and state-level buy-in. And in order to do that, you have to capitalize on the work in states and communities through this buy-in to implement this broader system change agenda. So a polling question we're moving to now is, which areas in your state need the most improvement? State-community communication, partnerships, seed funding, incentive funding, state leadership, community leadership, state buy-in and support, and community buy-in and support. So let's see where you shake out on that. Pretty similar across a lot of these. Structures for partnership supports is edging ahead a little bit. Wow, state leadership and community leadership seem to be doing pretty well in most of your states and communities, so that's encouraging. So it sounds like mostly the structures for partnerships need to be worked on, and a little bit around buy-in and support and communication. But I think this is interesting because I think what we're seeing is that there is buy-in at both levels, and now it's a matter of thinking about how you can leverage that buy-in to create some of these structures and strategies to move ahead with your relationship and partnership building. Okay. One more thing I wanted to mention before moving into our examples is that there's some work also by NICWA, the National Indian Child Welfare Association, to look at partnerships between tribes and states. And this work is not completed. They're still, I believe, in the data gathering stage. But the questions that they're looking at are on this slide: how tribes identify the decision makers in states and counties with whom they should develop a partnership, what steps could they take when they want to set up meetings to discuss this, who would be the appropriate representatives from tribes to do this, how can partnerships between systems of care and tribes and state agencies be formalized, and what are the potential benefits. So this is new work, and I think you may be contacted by tribes that are within your states. One of the areas that we know is already progressing quite nicely is that a number of tribes have collaborated with their state Medicaid agencies in order to work to make families and children in tribal communities eligible for Medicaid reimbursement for their services, which has not happened in the past. So there are a number of areas that tribes are trying to explore in terms of how they can strengthen their relationships with states and work better with states in the future. Now it is time to move to our specific examples. And first, I would like to turn this over to Daryl Tenney and Dennis Calcutt from New Hampshire to talk about how they've accomplished this. Daryl represents the state level and Dennis represents the community level, and they can talk a little bit more about their roles and talk about how it is that they have worked together and are working together to make sure that their goals are aligned toward expansion and that they are in a synergy and trying to leverage each other's work to accomplish goals that, of course, they share. So I'm going to turn it over to you, Daryl, to take it from here.
Great. Thank you, Beth, and I appreciate everybody listening in on this. Welcome from the very small state of New Hampshire. So, you know, I was definitely, I'm really happy that kind of Beth really set the framework for a lot of our discussion, and we very much, you know, thinking of that kind of triangle tier that Beth, one of Beth's slides really represented, we really started at that bottom of that triangle when we first, you know, for our quest for change in New Hampshire. And so really what we were looking at was first initiating that state-level system of care expansion planning grant and a subsequent 4-year state-level system of care expansion implementation grant, with really the goals to establish youth and family and youth-driven wraparound, and we call that FAST Forward. It stands for Families and Systems Together. We also wanted to establish funding, policy, and state infrastructure to really support that development. And as you can imagine, it's a tremendous amount of work to get there. But we also wanted to establish the framework and expansion to address, you know, our very unique needs of our children and youth in New Hampshire. And so we did a lot of that planning up front to be able to get that going here in our state. Well, what we were finding is that we really had to spend a lot of time breaking down silos, and I wish I always say this in our training, so we use this in a training as well. But I would love to change the tornado because that really looks more of a destructive kind of graphic. But really, what we're looking to do is braid different siloed services that we had here in our state, and that was really one bigger area that our state looked to do to help establish expansion of that system of care framework to more effectively keep our families in their communities and enhance many services that we currently have. This is a very similar graphic to that. We're looking in that expanded that expansion and that really vision and quest for change. We really wanted to create that access to an expanded array of reimbursable services, and as you can see in this graphic, we're really just trying to blend that and braid that. We are finding in our state that many of our families have access to various services, but you have to very specifically be connected to certain ones to receive them. And so we are looking to really change that policy and practice so our families have access to a very broad array of services that are available. And so in that planning and implementation, we made sure to be able to set that system up statewide for that expansion. So looking at just kind of referring back to that tier, that triangle tier graphic that Beth had showed, we're really at to the point where we've statewide we had seen and have seen many great outcomes, positive outcomes for our youth and families across the state, and we've really started to shift that to expansion, and we've noticed many different interconnected and community efforts to help duplicate our statewide effort in making sure that we're meeting the needs of our families. And so this graphic kind of shows some of those community efforts that have popped up across the state of New Hampshire. I'll move to the next slide to kind of more talk about that more in detail. So with that expansion, there's 3 local areas that we've really looked to in expanding to, and that's a state level expansion grant that is managed by the Department of Education, and we have 3 school districts that have really looking to implement and replicate what Fast Forward and the original state's grant has implemented across the state. The other, which Dennis will speak a lot to today, was the Monadnock Region System of Care expansion grant, which is really focusing on one public health region in the state, which is really started to be established during the summer of this year. And again, Dennis will get a bit more in detail on that. But we've worked very closely with that Monadnock Region System of Care systems change grant to be able to closely replicate what we're doing here in the state of New Hampshire. And most recently, there's also a wraparound initiative in one of our integrated delivery networks in a particular region as well. It looks a bit different to our statewide program, although most of the components are exactly the same. So we're really looking to provide that technical assistance in being able to yet again expand to a different region area within the state and be able to build that as we move forward. So from here, I am going to hand this over to Dennis Calcutt, and he's going to speak a little bit to his experience with kind of state partnerships and on a community level.
Thanks, Daryl, and I just would reiterate what Daryl said, and also a thank you to everyone from the TA network for inviting us into this process, because it's really been a wonderful process to be involved in. And I think when we think of it with respect to this partnership, I think in many respects it's come pretty naturally, and that's because at the start, you can see in this slide here we're referencing who's been involved and how we're continuing to be involved, but through this whole regional component in the Monadnock region, for those unaware of the state of New Hampshire, is in the southwest corner of the state, abutting both Vermont and Massachusetts, but it's all surrounded by Mount Monadnock, and that's why the region is known that way. But throughout the whole process, we've had state involvement. We've had one of Daryl's colleagues sitting with us during the planning process, and that was a twice-a-month meeting that was occurring in our region, so that was taking a lot of time out of their days, but they were really there as a partner, and they were fully involved. They weren't directing us, they were really advising us, and that was really very helpful, especially in a rural state where you can feel the distances of getting to one part to the other can be a little daunting at times, at least in terms of how your day can go. So they were very involved, but very much on an advisory level, and really said to us, here's what we'd recommend, here's how we can partner with you. And, and then our implementation was really focused on those next pieces of really being fully aligned. But you can see in the slide here, the reference is, that we are still working with one managed care entity in the state. We are working with our state partner for our peer-to-peer support for family support, and that's NAMI New Hampshire, and they're a great partner. And Youth Move has been a group that really has come a long way to bring that youth voice to the table. And, being a small state, as Dale mentioned, having evaluators from the Center for Behavioral Health Innovation at Antioch University is very helpful, because that is providing the data that will help us all understand the growth we're making, the successes we're making, where the savings can be, but really having a consistent line of data and evaluation for us. This just touches on some of that, the results of the statewide partnership. The biggest result is Daryl and I know each other well. We're on the phone. We were already on the phone together twice today, but we are truly partners. And those partners we are asking questions of each other. We're asking for support from each other. Training is centralized. So, when we are doing a wraparound training, that training will, one example is we held a cultural diversity training yesterday, and that goes out to everyone. And we, as a region, we're sponsoring that, but any one of our partners is more than welcome to be part of that. And we had members of the CME there. We had members of the Child Protection Agency there. We had our own members there. So it helps in two ways. One, it allows us to share those resources. But the second piece, and I think probably the more important piece, is we're really starting to move the system of care values and system of care voice to another level within our state. And I think that's crucial. So this is just going to touch on the Monadnock region approach. As Daryl touched on there, we are a small state. This population of kids and families within our state who are struggling from real significant emotional and behavioral health needs have had major challenges within our state. And this has really been an area that I think the state took the lead, and we as a region have followed it up, is if we're going to really help this population, and who in many respects have been disenfranchised in many ways, this is a wonderful opportunity to do it, and it will really provide an avenue for these children and these families to get the support and the help they need. And it's done in those system of care values, that is family-driven and it's youth-guided. And that's so important. And that does get to some of the struggles that we also have in this process, is that lots of our agencies, lots of our organizations will start to say to us, well, what's the difference? What's the difference from what we're doing here and what you're doing there? And when we try to walk them through that process of understanding that family-driven aspect, at times for some it's a struggle. And as we continue to do this work statewide and regionally, I think we really are starting to make inroads into that. And I think families are valued in a greater way in this process. And that really goes to our partner, NAMI New Hampshire, because they are really helping us guide this process with families. This is just touching on some of the things I've touched on before, but when you're designing these pieces, really have that alignment and get to know each other and make sure that partnership is there. And we really have benefited from the heavy lifting that the state has done, but I think the state has benefited from us. And we are true partners. We had a statewide call yesterday as well, and in that statewide call, I never have a concern that I can't raise in that meeting. I know the state partners are there. I could call on them at any point in time in this process, and they've been very supportive. They provided feedback to us in all ways, both positive feedback, critical feedback, but it's, I think, for us, having that population that we really know has struggled in the state and having that commitment both at the state and local level, working towards that group of children and families has really been the guiding force for us. And really now bringing that, the system of care values to another life is really, I think, providing another avenue for these families to feel most hopeful. As I've talked to people within our region, I sort of describe the professionals as the skeptics because they've lived through grants and they've lived through initiatives. And the families have been more hopeful in this process that because they've been brought to the table in a different way. They're brought there as real partners, and we value them as partners, and they're very involved in this process. And I think our professionals and the others working with us, they haven't given up on us. I've just said, you're skeptical, and that's good. But they've really started to come around and really worked with us in this process. This is just touching on more of what we've been doing and what it's looking like. I think the unified approach really sends those clear messages out to people. The sharing of resources really says to people that we're doing this together. It's not the state dictating to us the way it's got to be done or us saying we've got to do this in our region because the state's not going to be there for us. It's been very clear throughout this whole process that we have had tremendous support from the state, but tremendous support as we've moved this initiative forward from our local statewide philanthropy organizations, both the Endowment for Health and Kim Firth and her work there in terms of pushing this work forward, but then also our charitable foundation has really stepped up and helped us when we've needed small bits to keep moving us forward, and that's really been great. I think we're just touching on the alignment here again. I think I've covered most of this. Darryl, I don't know if you have anything to touch on or that it would make sense for us to touch on together for a moment, but I think we've covered most of what we wanted to get at.
No, and I don't think I have much more to add other than from a state level, we're going to always continue to support regions much like Monadnock, and I think the work that goes on in all our regions that we help to support really benefits the state as a whole, but we're able to really meet the needs of our families and youth and families, and that's really what it's all about. And we've tried to do this work collaboratively to ensure that our families are able to stay together as a family and be a part of a community where it wasn't feeling like that beforehand. So I think a lot of this work, there's still more steps to go, but these relationships really help to do that as we move forward.
And I'd say the biggest piece that's beginning to unfold statewide is how do we really think about this at a legislation level and at a state policy level. And I think that's Darryl's colleagues, Erica Ungrelli and Adele Gallant, who've really guided us through that process and are continuing to guide us through that process of how are we going to sustain this work long term. And they're doing some extremely heavy lifting on that end of it, but I think it just continues to come back to how do we really partner and how do we all see ourselves together in this process, and it's really a common vision. And as this work has expanded with the Department of Education now, one of the communities they're working specifically with is very close to the Monadnock region, and we've already begun working with them, and we've found common areas where they're touching on it, because when we started this work as a region, we really talked about how do we look at awareness and readiness within our region. We did a whole readiness assessment to understand, okay, how ready is our community for this work? And we really started to try to move that up with respect to awareness, but we're also getting at, and this was really guided by our families who said, I don't want you just to be completely focused on that highest need population, though we know that's where we've got to be, but they've been really pushing us to say, how do we get to those earlier populations? So we've partnered with local initiatives around the early childhood work that's happening within our state and early screening and using the ASQ-SE, the Ages and Stages Questionnaire, social emotional. So that gets at both the readiness, some of the screening, and then it also gets at the awareness with our work with youth mental health first aid across the region, which is partnered with the Department of Education again. So we're really finding a lot of synergy and a lot of connections. But thank you again for the opportunity.
I just have one quick question for either Daryl or Dennis, and that is you did touch on your partnership with education because this is a new initiative that has joined the statewide System of Care Implementation Initiative, and this is very well connected but also led out of the State Education Agency rather than the Behavioral Health and Child Welfare Agency where it was previously. Are there, can you elaborate on some particular strategies of how you have been involved with that initiative, which of course is just getting off the ground, and how all of that is being tied together at the state level and then with community partners?
Yeah, I think I can speak to that a bit here as I'll need to leave here in a couple minutes, Beth, so I apologize.
Yeah,
but
yeah,
I'll quickly kind of speak to that. I mean, strategically, it takes a lot of conversations, as you can imagine. I think the two, between behavioral health side, like you mentioned, in Department of Education, there's a, I don't want to say this in a negative way, but I think there's two kind of different philosophies in some fashion. I think, education is so good at preventative pieces, and behavioral health really works with kind of that high tier, really high need population. And so it's really kind of bringing that common language together to look at the strengths of each, and really talk about things critically, but also in a constructive way. And so I think those conversations do need to happen. They can be hard ones, but they can be so beneficial in how we roll that out. That's certainly a huge part of that.
If I can just follow up on a bit of that, we have seen, I think Daryl in his work with the Department of Education is the statewide work, but we're also seeing some of those same struggles at the local level. And I think where that plays out is when you look at the system of care values and how do you bring that family voice to the table, a lot of times school districts have not been as family-friendly as they hope to be. And families have really struggled with school districts around this. So it's allowing us to have very, sort of in-depth conversations on a very local level with some of the districts that we're working with, whereas Daryl's working on it on a broader level at the state level. And so I think we find moments where we can really share that information, and then we bring those partners in to help us think about that very specifically at a local level and then very broadly at the state level.
Great. Thank you very much to our New Hampshire presenters. Daryl, I know you have to leave, so particular thank you to you.
Appreciate it.
Dennis will be sticking around for the Q&A portion. And now I'd like to move to the example in Virginia. And we have with us Anna Antel, who will represent the state level, Rochelle Butler, the community level. And I'm going to turn it over to you to talk about what kinds of approaches and strategies you've used in Virginia to accomplish this.
All right, thank you so much, Beth. Yes, so I'm Anna Antel. I work for the Office of Children's Services in Virginia, and I'm sorry that my colleague Pam Fisher couldn't be here today. She works for the State Behavioral Health Agency, who is our current System of Care grant holder. My agency and office is a strong partner with Pam and her team for the System of Care work, but I did want to just acknowledge her and all of the work that her agency and team has done. So Virginia is a commonwealth, and as a result of that, state and community partnerships have been essential to the work and to any real successful work in Virginia and from the beginning of our system of the development of our system of care. And this slide covers a little bit of historical information that sort of all laid the groundwork and was the build-up to where we are here. One of these at least even predates my birth. So we are really talking about an evolution here in Virginia. But in 1968, the development of the Community Services Boards occurred. Those are our community public mental health agencies. They are something that is required in the Code of Virginia, but are established and administered locally with support and some oversight through licensing on the state level. But it really is a state and community partnership designed to ensure that there is a single point of entry to the public mental health system for Virginia. And then sort of growing up a little bit in our history, adding a few more years, in the 80s, Virginia was fortunate to receive one of the first CAS grants, and that really began the system of care work in Virginia. And then a few years later came another piece of legislation titled the Children's Services Act that occurred in 1993, was a piece of legislation that pooled together funds, state funds, to, as it says up here, to create a single sort of source of purchasing for services for at-risk youth and their families. And it is truly a state and community partnership. It is a program that is state supervised and locally administered. There are state pooled funds that go into the act, and there is a local matching of the funds as well. The piece of legislation also required the establishment of multidisciplinary teams at the community level and actually also at the state level. And at the community level, those teams develop policies and procedures. They determine eligibility. They recommend services, approve funding, and there is a state agency, the state agency that I work for, that guides, supports, trains that implementation. And so from all three of these pieces of Virginia's history, we see that partnership between states and communities. And if we really dive into the direct system of care expansion work in Virginia, we are fortunate here to say that we've been able to receive 3 system of care grants. Beginning in 2011 with a planning grant. 2012 we were granted an expansion implementation grant, and in 2016 we were awarded an expansion and sustainability grant. And for all 3 of those grants, Virginia has utilized its history and its commitment to state and community partnerships to implement the grants. Each grant is focused on developing and expanding systems of care in the communities and also at the state level. And as the work has occurred at the community level, the state partnership has been there to support them, to guide the work, to offer technical assistance and training, and of course also funding through the grants and other state resources which we'll get to in a moment. So a little bit more about the history. Right now we are thinking even before we got the first planning grant in 2011, during the time frame of 2006 to 2009, in Virginia, there was a large number of youth who were placed in residential treatment facilities. And the state wanted to look at sort of how do we incentivize bringing those kids home and serving them in the community. And so the Office of Children's Services, which is the state office here that I work for, which is connected to the Children's Services Act, offered grants to communities, and those communities would be using state dollars to develop programs to focus their work on transitioning those kids back from residential placements to community-based services. As with everything in CSA, you utilize the state pool dollars, and there is a required local match. And so in an attempt to, incentivize the use of community-based services and support these grants, there was the use of the local match, and also the local match rate was changed such that if you utilized a residential placement, you had to put up a higher local match than if you were using community-based services. And this was a decision that hoped to put the focus more on the use of community-based services. And it really laid the groundwork for the implementation of intensive care coordination and later our endorsement and use of high-fidelity wraparound. And so building upon that, we got to this place in Virginia in 2009 where as I said, building towards intensive care coordination, the service of intensive care coordination was formalized. And the target population was focused on youth who were in a residential placement or who were at risk of entering a residential placement. Thinking about it being a state and community partnership, the community services boards, who are those community mental health agencies, were the providers who could deliver the service of intensive care coordination. And as part of the act which created intensive care coordination, there was a requirement that the local team work together to develop what their policy would be for the use of ICC, and then also through that piece of legislation created the funding source. And some of that you talked about when you were talking about the importance of funding. The Children's Services Act, that state pooled dollars, which is available in all of the community teams for children and youth who are eligible, became the funding source for the service of intensive care coordination, and that funding source continues today. And so with any new rollout, with any new anything, comes some challenges. And this time period we're talking about right now is from 2009 to 2011. This is before Virginia got its first system of care planning grant and was working on figuring out these community and state partnerships and system of care work sort of through its own funding and its own processes. But as I said before, Virginia is a Commonwealth. The Children's Services Act is a state supervised, locally administered program. The service of intensive care coordination was developed, but there was not a consistent way in which it was delivered. It also was not required that every CSB provide it, so it wasn't always available to youth and families. There was confusion about the role, and what sort of happened is that this thing that we called super case management was created and evolved, and that sort of became the role of ICC. There was some belief in understanding of wraparound, but Virginia also didn't have the funding and the access to training to really be able to formalize the use of the wraparound process. And so this super case management became the way in which ICC was delivered. And so then came this wonderful opportunity in which the state of Virginia, through DBHCS, that's a state behavioral health agency, was awarded a one-year planning grant, and that grant was from 2011 to 2012. And that's where the state really, in partnership with all of the agencies that are a part of our system of care, really looked at what are the lessons that we have learned along the way here as we have been doing this work, and where is it that we want to go, what are the values, utilizing the System of Care Expansion Toolkit from Georgetown. And from this planning grant, the team was able to develop some consensus that high-fidelity wraparound was going to be the approach which was utilized to deliver the service of intensive care coordination, and that high-fidelity wraparound would help to further advance the system of care values both at the state and the local service delivery system. The partnership between the Office of Children's Services, that's the office that I work at, and BVHDS, where Pam Fisher works, was strengthened, and each office sort of had a distinct role in while working together within the process. And the team also identified the strong need for family voice, and the Virginia Family Network has really grown and strengthened, and we have added the youth voice component as the system of care grants have evolved. And we have seen that has evolved at the local level too, through the support and guidance and really leadership out of our state family network. And so during the first 4-year System of Care Implementation Grant, which was from 2012 to 2016, the Department of Behavioral Health and Developmental Services put into action the plan that was developed in the first planning grant. And what happened there was that there were some state policies that were formalized, including most specifically the one related to the delivery of intensive care coordination, the service requiring high-fidelity wraparound in the process. And the state developed the Wraparound Center of Excellence, which was responsible for the training of high-fidelity wraparound. But then there was community work happening as well. And while it was a state grant, the DVHDS really saw the importance of growing this process. If the service was going to be successful at the local level, the communities who would be delivering it would need to be involved. And so DVHDS awarded 5 sub-grant sites, made awards to them, and those communities were responsible for what they were working to do was improving system of care in their community. They were utilizing high-fidelity wraparounds. There was a requirement that they would utilize family support partners in the high-fidelity wraparound process. And the state partnered with those communities to ensure that they had the technical assistance they needed. We provide, through the Wraparound Center of Excellence, we provided training. And the idea was to sort of take what these communities were doing and were learning and then hopefully be able to spread it across the rest of Virginia. And so again, we come to this place where we did something and then we learned some things. And so from the first implementation grant from 2012 to 2016, there were some lessons learned. And those lessons learned are around the importance of having sub-grantee awards in diverse parts of Virginia. The first go-around, 3 of the grants were in one part of our state in Northern Virginia, and so there were pieces of our state that didn't have necessarily the direct access to the opportunities that those sub-grant sites had. And so DVHDS recognized that it was really important that the love was spread across the Commonwealth. And we learned what worked well on the community level. And my colleague Rochelle will talk about some of that when her slides come up. But from the sub-grant sites, we learned what are the best strategies, or what most effectively helps to bring that system of care, improve that system of care at the local level. And we also really learned the importance of information sharing and reporting between the communities who hold the grants, the sub-grants, and the state agencies that is the larger grant holder. Because if as a state system we really want to improve policies, we want to continue to build buy-in, we want to influence change across the state, we really need good, solid, and consistent data and information from the grant sites about the effectiveness, so that then that information can be shared and utilized to do the things that I just said. And so we were given the opportunity in 2016 to continue building on the things that we have done. We took this opportunity for the Expansion and Sustainability Grant to utilize those lessons learned and keep going. And so for this current grant, the DBHDS again put out an RFA and sought proposals for, they call them System of Care Expansion Centers. I really like that Communities of Excellence term. I'm going to call all these people our Communities of Excellence, I think. And again, they were sought for in 5 geographic regions, and the intent and the expectation was that they would be from different regions than had access to the grant before, again, hoping to continue to expand this statewide. And so with this current grant, we went from having 13 localities participating to 48. And we are 131 communities in Virginia, just to give you a frame of reference. And again, so we built on these lessons learned. This current grant now requires coaching and fidelity monitoring for all of the grant sites, back to that importance of having the data and then doing something really effective and wonderful with that data. The state team has a state data coordinator on board, and the state team also at DBHDS has a team that mirrors the work that's happening at the community level, and I think that's really important as well. So at the state level, there's Pam, who is the project director, there's the data coordinator, there's a family lead at the state level, and a task lead at the state level. And those folks work with the people, the task leads and the family leads in the communities. And the idea is that there's a parallel process happening at the state level with the state partners as there is happening at the local level and in their communities. And hopefully those folks in each of those positions are working together and coordinating efforts, and so it truly becomes a partnership. And another really important thing that happened with this new 4-year grant is the recognition that there needs to be a family lead in each one of the grant sites, each one of the 5 regional grant sites, because as it said on the other slide, one of the lessons learned was really the importance of diverse family voice, and having just a couple parent leaders wasn't going to cut it. And so part of what this grant has required is the family voice, the family lead in each of the sites. And so I'm going to turn it over to my colleague, Rochelle Butler, now, and she is going to be able to speak to more of what happens at the community level and how the community successfully does what they do and partners with us at the state.
Thanks, Anna, and good afternoon, everybody. So like Anna said, I'm Rochelle, and I work for United Methodist Family Services, and we were lucky enough to be a recipient, a sub-grant recipient in the first grant, as well as this grant that we just got in 2016. And what made us a little bit different than some of our other colleagues around the state in the first grant was that UMFS is a nonprofit private partner, and we partnered with 5 local communities, and our first implementation of the grant was really a regional, we did it regionally, and so we partnered with our 5 localities and really acted more as a liaison between our local partners and the state partners. And what was really neat about that was we started to be able to really speak up, sideways, down, all around about what was going on, so that we were all collaborating on all levels. And as we did that, we were able to also build partnerships with other private providers through something called Coaching Group. We were able to collaborate with our government partners on the local level, and then also partner with our state partners. And so we had partnership all around. When we got the next grant, we had a discussion with our state partners about really expanding to more of a regional perspective. And so UMFS then partnered to 3 new regions, and so now we are partnering with localities across the state in 4 regions. And so another way that UMFS and our government partners really partnered with the state was through high-fidelity wraparound trainings and coaching. And so through our conversations in the first grant, the state really wanted to make sure this was sustainable. And so we were lucky enough to have Anna as our statewide trainer, but she was the only one. And so she reached out to the communities locally, and we were able to have 2 people become coaches, and then I became a trainer with Anna. And so in this next grant, the next goal is to have more local trainers around the state so that there's truly an organic local and state partnership where there's someone from the localities that is training, as well as a state partner to help train, to help long-term sustainability. And we also worked really hard to build the family support partner service with our localities and with our local government partners. And in this next grant are going to expand to start piloting the youth support partners. And then the other thing that we did was just sharing our local outcomes. One of the things that I found really helpful that both Pam and Anna did with their agencies was they hosted these calls for all the sub-grant recipients to talk to each other, where we would share our data and share our successes and what was going really well. But it was also really helpful because we would share our challenges, and it was neat to know we weren't alone in some of the challenges, and we could pull from each other to really understand what was going on in other localities. Okay, next. And so when our lessons learned, what we really learned through this was that it was really, really, really important that there was open communication and lots of different ways to do that. And so the state did an incredible job of making sure that we had regular conference calls. I think we did them monthly. That they did networking meetings. So we weren't only talking to each other via phone, but we also had opportunities to get together, get to know each other. We went to conferences together, lots of opportunities to build those relationships, not only within our own communities and localities and with the state, but also with each other across the state. We all had a shared vision. We're working towards the same thing, and we were able to have check-ins to make sure we were all working towards that shared vision. Sharing resources. I don't know that we could have built some of the programs that we built if we didn't have the help of our other colleagues across the state. The other thing that the Office of Children's Services did was they were able to create a website and one place to have all of the material we needed so that we had constant and open access to those things. We shared our family stories, expertise. We now are going to start having opportunities for all of our family leads to have a community and to start sharing resources. And really, it allowed for, in Virginia, it really allowed for us to have local creativity so that we could really meet the needs of our individual localities as well as the state. And Anna talked a little bit about the parallel process and really being able to have that parallel process both on the local level as well as the state level. I really think that the leadership on the state level paved the way for what it should look like, and we're continuing to learn and grow, but we absolutely, I think, were able to come as far as we did because of our partnership with the state. So that's all I got.
Okay, thanks to all of our presenters. We have a few minutes left, about 5 minutes, for questions and answers. And I think the presentations gave us a lot to think about. We have one question so far from Joni, who wanted to talk about the evaluation piece on state-community partnerships and any lessons learned or major highlights about that. I wanted to mention briefly that the national evaluation of the System of Care Expansion program does have a component on network analysis. And in the past, it's been a broader look at network analysis at both the state and local levels. This time, there's going to be a specific focus on state-community partnership and communication. So I think we'll learn a little bit more about that through the national evaluation of the expansion program going forward. But I think maybe some of our presenters have some insight in that area as well. Dennis, I know you have something going on in New Hampshire that you could talk about that's relevant to this.
Sure can. I mean, the partnership we have with Jim Falp and his group at the Center for Behavioral Health Innovation at Antioch is just tremendous. They're thorough, they're collaborative, they really work to help us improve the practice. And Daryl and I were able to connect just to touch on this, because Daryl was one of the coordinators at the start of the grant in New Hampshire, the statewide grant. And they've been able to, the evaluators have taken that information they learned in the first grant, applied it to us. We've really enhanced it, and now it's getting applied to the next group, the Department of Education group. And so it really becomes this collaborative learning approach, moving from one piece to the next. And it really is focused on how do we improve the practice, and how do we make sure that when we've talked about evaluation, I've asked this of Jim at times, and his statement has been, we don't look at evaluation from let's do a project or let's do an initiative and then evaluate it. It's let's evaluate it continually through the process. And that's really been happening. And he's doing it on several levels. So he's evaluating the wraparound, the components, the measures such as the NOMs, and making sure all that's happening. But then he's also helping us with the evaluation of our infrastructure measures, which is going to get at the readiness piece and understanding the partnerships developed. And in the end, I think we're really going to start to understand how system of care has started to move throughout the region as well as across the state. But I think, we're fortunate to have great partners, but I think more of it is really his focus around how do you continue to improve as you move along.
Thanks, Dennis. That's helpful. I see also a question from Casey. Is there a forum or centralized collaborative location to upload materials, successes, and lessons learned? I don't know that we have that through the TA network yet, although we compile materials as much as we can from communities. Do either of you in New Hampshire or Virginia have any materials that you think might be useful to some of the other states and communities that participated?
Beth, this is Denise. While Virginia and New Hampshire are thinking about resources, we will have the TA Network website will finally be up soon. We are bringing that up outside of our SAMHSA contract. We also have the mechanism for you all to sign up for the System of Care Leadership Learning Communities listserv, and that's a mechanism to share resources with one another. And I also advised Casey that everyone's more than welcome to share their resources with you and I, and we can disseminate them as well.
Okay, great. Much better answer than mine, Denise.
Well,
any other questions? We make a good team. Any other questions before we close? Okay. The files are there for downloading. I see there may be some technical issues, but Tiara, our tech person, is trying to work with that. In the meantime, I would like to thank our outstanding presenters. One of the things I particularly liked about this is that the strategies that they offered are very practical and strategies that you can apply in your own states and communities. So I always appreciate when we move to the theoretical and a theoretical framework for exactly how this can be implemented in these kinds of hands-on approaches that you can use in your own jurisdictions. So thank you, presenters, for that. Much appreciated. And I'd like to thank Tiara from our tech team, who handled all the logistics and the technical aspects of this. It went beautifully. Also, my partner here, Denise Sulzbach. And before we close, I'd like to remind you of our November 15th Learning Community Session, again, which is on strategies or considerations for system of care leaders as they think about expanding their systems of care to serve youth and young adults in transition to adulthood. So with that, I would like to thank you as participants for participating in this web event and for hanging in with us through the entire thing. And we hope to see you in November and in all of our future